Have you ever wondered if your past or current health issues could prevent you from getting the Medicare coverage you need? Maybe you've heard that pre-existing conditions can block you from enrolling in certain plans or make your premiums skyrocket. Today, we're going to unravel the truth behind these common myths, and by the end of this video, you'll feel confident navigating Medicare without fear or confusion. Let's start with the first myth, the idea that Medicare penalizes you for pre-existing conditions. This is one of the biggest misunderstandings I hear from seniors every single day. Here's the reality. If you're turning 65 or already eligible for Medicare due to a disability, your pre-existing health conditions do not prevent you from enrolling in Medicare. That's right. You cannot be denied Part A or Part B coverage just because of your health history. The law is clear. Medicare is guaranteed for those who qualify by age or disability, regardless of your medical past. Now, let's talk about Medicare Advantage, also known as Part C. Some people worry that if they have chronic conditions, such as diabetes, heart disease, or arthritis, they might not be accepted into a plan. While it's true that private insurers manage Medicare Advantage plans, there's good news. These plans are required to accept all eligible beneficiaries. That means your pre-existing conditions cannot stop you from enrolling. The goal of Medicare Advantage is to provide comprehensive coverage, and these plans are designed to serve people with various health needs, including those who require ongoing medical care. Moving on to Medigap, or Medicare Supplement Insurance. Here's where things get a little tricky. Medigap plans do not refuse coverage for anyone enrolling at age 65 during their initial enrollment period, even if you have serious pre-existing conditions. That's your guaranteed issue period, and it's critical to understand. Outside of this window, insurers may apply a waiting period for pre-existing conditions, but that doesn't mean you're denied coverage forever. It simply means certain medical expenses related to your condition might not be covered immediately. Understanding when your guaranteed issue period starts can save you a lot of stress and out-of-pocket costs, so it's something every senior should pay close attention to. Another common myth is that pre-existing conditions will make your Medicare premiums unmanageable. Here's the reality. Your premiums for Medicare Part A are usually free if you've paid Medicare taxes through your work history, and Part B premiums are based on income, not your health. For Medicare Advantage, premiums vary by plan, location, and the additional benefits offered. But again, your medical history does not dictate your monthly costs. The same goes for Medigap plans during your guaranteed issue period. Premiums may differ slightly based on your age or location, but not because you have a pre-existing condition. It's also important to address prescription drug coverage, or Medicare Part D. Many seniors think their pre-existing conditions, especially chronic illnesses requiring regular medication, could prevent them from getting a Part D plan. That's simply not true. Every eligible beneficiary can enroll in a Part D plan, regardless of health history. However, timing is crucial. Enrolling during your initial enrollment period or during the annual open enrollment period ensures you get the plan that best meets your medication needs without facing late enrollment penalties. Now let's take a moment to dispel another myth, that pre-existing conditions mean you should delay Medicare enrollment to avoid higher costs. In reality, delaying enrollment can be one of the costliest mistakes a senior makes. If you don't sign up for Medicare Part B when first eligible, you could face late enrollment penalties that increase your premiums for life. And if you need care while uninsured, you'll be paying full price for medical services. So rather than delaying, understanding your options and enrolling on time protects both your health and your wallet. Here's a practical example I like to share with my patients. Imagine Mary, who has diabetes and arthritis. She's about to turn 65 and is worried about Medicare. She consults a Medicare advisor, learns about her guaranteed issue period for Medigap, enrolls in Medicare Part A and Part B, and chooses a Medicare Advantage plan that covers her routine doctor visits, medications, and therapy. Mary's pre-existing conditions didn't stop her from getting coverage or limit her options. With the right guidance, she's secure and ready to manage her health. That's exactly what you can do too. Understanding your rights as a Medicare beneficiary is essential. The government has rules in place to protect seniors from discrimination based on health conditions. These protections are not optional, they're enforced by law. That means you don't have to worry about being denied coverage or charged more simply because of your health history. Knowledge truly is power here, and it's why so many seniors feel relief once they understand how Medicare really works. Now, let's address the elephant in the room. Navigating all these rules can feel overwhelming. Medicare terminology, enrollment periods, plan comparisons, it's enough to make anyone feel lost. That's why having guidance like from Medicare Mentor can make a huge difference. We focus on breaking down complicated information into simple steps, helping you understand what coverage you qualify for, what plans make sense, and how to avoid unnecessary penalties or out-of-pocket costs. Before we move on, here's a critical tip for anyone with pre-existing conditions. Keep a detailed record of your medical history, current medications, and your routine care needs. This helps you evaluate which Medicare Advantage or Part D plan covers the medications and services you rely on most. Even though your pre-existing conditions won't block you from coverage, having clear information allows you to choose the plan that offers the best value and peace of mind. It's also worth noting that preventive care is widely available under Medicare. Whether you have heart disease, diabetes, or another chronic condition, Medicare provides screenings, vaccinations, and wellness visits that help you stay on top of your health. These benefits are available regardless of your medical history and are designed to catch issues early, often reducing long-term costs and complications. Pre-existing conditions don't limit your access to these essential services. Let's take a moment to address one last myth, that changing your Medicare plan because of your health needs is complicated or restricted. In reality, Medicare gives you flexibility. During the annual open enrollment period, you can switch between original Medicare, Medicare Advantage, or Part D plans based on what fits your needs best. And if you experience certain life events like moving to a new area, losing other insurance coverage, or qualifying for extra help with costs, special enrollment periods allow you to make changes without waiting. Your pre-existing conditions don't lock you into one plan forever. You have choices. To summarize, here's what you need to remember. Pre-existing conditions cannot prevent you from enrolling in Medicare Part A or Part B. They cannot block you from Medicare Advantage during enrollment periods. Medigap coverage is guaranteed during your initial period, and Part D prescription coverage is available for everyone. Your premiums are not determined by your medical history. Delaying enrollment can be costly, and proactive planning is essential for long-term health and financial security. So, if you're approaching 65 or already eligible for Medicare, don't let myths about pre-existing conditions keep you from getting the coverage you deserve. Take action, review your options, and make informed decisions. And if you want to make this process even easier, reach out to Medicare Mentor. We help seniors like you cut through the confusion, understand your rights, and choose plans that provide real security for both health and finances. Remember, Medicare is here to protect you, not punish you for your medical history. Your past health conditions do not define your future coverage. With the right guidance, you can make Medicare work for you, ensuring that you get the care you need without unnecessary stress or expense. Thank you for watching today. If you found this video helpful, subscribe to Medicare Mentor for more tips, insights, and step-by-step guidance on how to save on healthcare while maximizing your Medicare benefits. Stay informed, stay empowered, and take control of your Medicare journey today.